Excellent. So from here,
PIR for AC,
SCM
SCM.
positioning is going to be as simple as it gets. We're going to rotate maximally to the contralateral side. So we have right SCM involvement. We're going to rotate all the way to the left. So let's do that. And that SCM should be highly visible. Next from here, we're going to continue supporting the skull and now just lower the headpiece as we support the skull. So the headpiece goes down, but it's magic, the skull stays in the same place. Now we can gently lower until we find that first barrier of tension, right about there. And in this instance, all we need to do is resist the opposite side of the patient's forehead, or rather their temporal region of the skull. So they're going to be pushing up into their resistance, same side as the muscle that's being treated, using 20% force, 10 seconds, looking up, breathing in, all the good stuff about PIR. And the great thing about SCM is that you will see it contract if you are doing this correctly. And if not, then work with your positioning, work with your patient instructions until they get this muscle contracting. After the 10 seconds, they relax, look down, breathe out. And now, if you set your headpiece far enough down, which I did not, because it doesn't go that far, that's a shame. So you may actually have to have the patient come towards you if there's not enough room. But in general, you'll be able to get most people this way. So you'll be able to continue to lower them down. This is really mostly left lateral flexion, but it looks like extension because you're moving straight towards the floor. In any event, it doesn't matter what you call it, as long as you bring the SCM into a greater position of stretch after you find that first barrier. So that's what we're looking at here. SCM, press up into the hand. After the 10 seconds, you simply lower the head towards the face piece, finding that next barrier, and then repeat. So, questions for SCM?
How is it different from posterior scaling?
Because there's no contralateral lateral flexion as such, that is to say in our initial positioning, and additionally we're putting the stretch just on the scale or just on the SCM rather than posterior scaling. For posterior scaling, we have to laterally flex and extend. Good. Any other questions for these? Okay. Let's look at the other two. I think we'll be able to work with these three in a block. So now we'll look at the levator scapula muscle. And let's say we have right levator scapula dysfunction. So from here, we're going to need to depress the scapula as we flex, laterally flex, and contralaterally rotate the cervical spine. So we're doing everything away from that involved side. We're laterally flexing away, we're rotating away, and then we're flexing, which is technically away from a posterior muscle. So all of these movements are away because we're stretching the muscle. So we're distancing origin from insertion as much as possible. So we're going to support the skull with one hand, slide underneath with our other hand to depress the scapula, and now we can let the skull rest through our hand onto our forearm. So there's no lifting involved in this. And I would encourage you to check in on your positioning because this can be really uncomfortable if you're trying to do too much lifting. So next from here, you can combine those movements until you find that first barrier of stretch, right about there. Then the patient's just instructed to bring their shoulder and their ear together, moving at both the neck and the shoulder blade. So they're trying to elevate the scapula, and they're also activating the cervical fibers of levator scapula by moving their neck. After the 10 seconds, they can relax, breathe out, eyes down, and then we find our next position both by slightly increasing our depression at the scapula and by moving the head and neck into that next barrier position. So, again, 3 repetitions is standard, after which you can reassess. And then lastly, we need to look at upper trapezius. And the upper trapezius is very similar to levator scapula, except that in order to create a stretch, the rotation will be in the opposite direction. So for right upper trapezius, instead of the left rotation we used for levator scapula, now we'll use right rotation. So a mnemonic for that is watch out for the trap. You can kind of look suspiciously at your own upper trapezius. Same side rotation. So we have that over here. We'll do the same thing. We'll gently lift, giving some flexion as well as contralateral lateral flexion. So that's the same both times. You laterally flex away, you flex, and then in this case you'll be rotating towards the affected side. Again, we can sneak our opposite side hand underneath to depress the scapula, increasing our stretch, and allowing the skull to rest through our hand onto our forearm. So again, no lifting. Find our first barrier of tension. The instruction is the same. Try and bring your ear to your shoulder and shoulder to ear. Again, looking up, breathing in. And then after 10 seconds, looking down, breathing out, relaxing, waiting the 1 to 2 seconds for the muscle to let go, and then finding that next barrier. And so one thing that can be difficult to trust initially while doing this technique is that a slight stretch is somehow better than a really enormous stretch. And it would be great if you just wanted to trust me on that. But oftentimes it helps if you go practice at home, just doing a very light stretch on a muscle that's being bothersomely tight. And just give it a couple days of doing that light stretch procedure and see how it responds. And if you're feeling like a guinea pig and you have some tightness on the opposite side, you can really stretch the heck out of that one for a few days and see how they feel to you. And that'll give you kind of a sense for the level of improvement that you can expect doing one method versus the other. And it's really worth checking in on because there's a lot of stretching prescription happening, especially in the athletic world, that is needlessly aggressive. And that's something that, sometimes people who do a lot of intense sports sort of like the feeling of it, but unfortunately it's not going to produce a better result. So just kind of